If you have any questions, you can either put them in the question box, or I mean in the chat, or you can raise your hand, use the raise your hand function, and I can call on you. You should be able to speak.
Okay, good morning, everyone. Welcome to the WMC Policy Committee meeting. We have 2 items on the agenda for today: the non-WMC rulemaking midwifery legend drugs and devices, and guidance document medical records. We'll start with the midwifery rulemaking. And I know that there were some comments and some input on this, and it's quite a lengthy document. So thank you for reviewing and taking the time to put your comments in. Who would like to go ahead with their input?
So Chris, I could chime in real quickly.
Thanks, Pam.
Yes, so for those that I don't know, I'm Dr. Pam Kohlmeyer with the commission, and the midwifery group has done amazing things through the interested parties meeting that happened December 8th. And Kathy Weed, who couldn't be here today, recommended that Jennifer Santiago give an update on what happened in that process. It was very collaborative. So Jennifer, if you're okay, I would sign over to you to give an update.
Great, thank you, Pam. I'm Jennifer Santiago. I'm one of the executive directors here at the Department of Health, and I work with Kathy Weed and the midwifery program. At your public comment meeting that you had in December, there was some comments related to 2 very specific areas of the legend drugs. And in the document that you have showing, I think it's about on page 26, and I have it open elsewhere. But there was 2 changes made to the document, and I'm not sure if this document has those changes or not. And 25, page 25, if it's the right version. A little further. Yeah, there it is. So in red, one of the comments from, I believe it was the Medical Association, indicated that they wanted more clarity around this particular area and that it's only pending transport. It's not a common administration or prescribing. It's during that transport of the mother. And then the other area, I believe it's on page 26 at the bottom, there was a concern that we used an acronym, which we shouldn't have, and that we replaced that with the word miscarriage to be very clear what that medication was for. And so those were the 2 changes that were made from the draft that the Medical Commission had presented at their public comment meeting. We've also presented this material to the Pharmacy Commission last month. They had a lot of great questions for our midwives and the program, and we worked through that with them. They had no recommendation of changes for this area of the rule. A majority this complete package changes a lot of things in the midwifery chapter, but the majority of it is really in this legend drugs section and the training for the extension, the license extensions. And for those that don't know, the legislature passed a bill in 2022 that authorized midwives to have a license, an extended, a limited prescriptive license extension. So it basically broadened their scope a little bit. And so that's what this rulemaking is all about. Do we have any questions? And I do see that I have 2 of our midwives on the line that could help with any scope or practice questions, because I'm an administrator. I'm not a practitioner.
Can I just make a comment? Sorry, I couldn't figure out how to raise my hand. So Diana Curry, OBGYN. So I was at the public comment meeting and have participated most of the meetings over the last, gosh, I don't know, it feels like it's been a year, but working through a lot of this stuff. And I feel like the midwives have done a great job sort of sorting through all the concerns or questions that came up from WMSA and various other people. This does extend their ability to prescribe. It doesn't give any kind of specific diagnosis, specific drugs, like it's more like general statements. This one about the nifedipine pending transfer, that was one of the more specific ones. But generally, things that are considered kind of already in their, almost in their scope of practice or adjacent to it, and things that midwives have always worked hand in hand with other providers on, that now just gives them a little bit more autonomy to, you know, make the decisions. And in terms of amount of hours of extra pharmacy training or whatever, that all got sorted through. And then there's a few things around like devices like IUDs and contraceptive implants that got sorted out. But I feel like there was a ton of work went into this document, and it's a good one. So that's my comment.
Thanks, Diana. Dr. Curry.
This is Pam Kohlmeyer. I want to make a comment too, as someone who grew up at some point in time in my life in a rural community. I enjoyed the discussion too about nifedipine, about, well, maybe there are rural providers that maybe to help the patient emergently pending transport, it would be indicated, whereas in other settings it wouldn't be, because you have other providers available. And so I really appreciated that acknowledgement.
Is there anyone else who wants to provide some input or questions, concerns?
Oh, this is Pam. I thought of one more. I really want to pat that whole group in the back too, that was very inclusive with their language, you know, chest feeding and whatnot. Sometimes wording like that impacts people significantly in a way that we don't realize. So I really appreciate the inclusiveness that was really well thought out throughout the document.
Any other comments, Amelia, from outside?
Doesn't look like it, no.
Okay, if there are no other concerns, then I think we have a motion at this meeting, correct? To approve this document with the changes as noted.
And just to clarify, my understanding is that this would go to the full commission at their January 19th meeting, correct?
Correct, that's correct.
Okay, thank you.
Yeah, so my
Yep.
understanding from Mike Farrell was that we don't have to like vote on this necessarily. This was like a discussion and review, that because the policy committee is so focused on preferred language and whatnot, that we would kind of not necessarily come to a consensus, but have another opportunity to discuss it here before it goes to the business meeting on the 19th.
Micah, you have your hand up?
Good morning. I just want to provide some clarity. We made the decision probably about a year or so ago that, and Amelia, correct me if I'm wrong, I don't think the policy committee approves rule language, but they review it. And then that goes to get voted on at the full business meeting. So if this was a policy or a guideline, you absolutely would vote on it to send it forward, which is why at the business meeting with those things, you don't necessarily have to have a second because it's already been approved by a standing committee.
Wonderful. Thank you. And thank you, Kyle, for putting that in the chat. Appreciate that. We have another hand up.
Thanks so much. I'm a professor at Bastyr University, so I help train midwives. And I just wanted to say, you know, we're here to be able to answer questions now or in the future or by email. And so please feel free to reach out to us if there is someone who has questions. Obviously, Dr. Curry, has a lot of information as well, having been at the meetings. But one question I had is if this will go through exactly the same with the packet, the same to the big meeting. because about the nifedipine question, and, I just didn't know if it goes through exactly as is, or if there's any need for modifications with that. If that makes
So
sense.
it should go
Yeah.
through as is in the
Yeah.
packet.
Thanks, Amelia.
Amelia, does that mean with the lines through things in the red, or is it a cleaned up version that goes through?
No, if it's rules, it'll always be the edited version where you'll see all of the edits.
Oh, got it.
Mhm.
Go ahead, Jennifer.
And so for clarification, because these rules are midwifery rules, our hope here is that we're collaborating with the medical commission as required through the statute, but also taking your input. And so we're going to leave those red lines there until we have a final version before we send it off and get the cleaned up version. Of course, when these rules pass and the department holds a rules hearing, these will go on into the chapter without all of the underlining and deletions and things like that. So just for clarity.
Any other comments?
No, I just would say that I think that's good, because I think that the only pushback may still come from some people at WSMA or something like that. So showing that this has been talked about, thought about, edited, et cetera, revised is, I think, a good thing.
And Kathy Weed has really done her due diligence and working with Billy at the association, medical association. And I believe we've addressed all of their concerns.
Okay, if there are no other comments, then we'll move on to our next agenda item, which is the medical records. And I'm so hardwired working at a hospital to always ask for firsts and seconds that, one of these days it'll leave my brain here. So anyway, next topic.
So yesterday we received a comment about the guidance document on medical records. And it is in the revised packet that is on the website. Let me send that link again for everybody that is here. Okay, and it is the last 2 pages. Sorry, with 2 of us in the same room, there's going to be some echo. Apologies.
No, you're fine. I don't hear it.
Pam figured it out. She figured out how to fix it. Okay, so we received this comment from the Washington Advocates for Patient Safety. If you go to that link that's in the chat, you should be able to review this. Since it's a late ad, you may need a few minutes to read it, so I will probably give you guys a few minutes to read it, and then you can discuss.
Has everybody had a chance to review? And are there any comments?
I don't have any objections to it. I just wonder if the attorneys have reason they would care. I mean, HIPAA is a law,
Mhm.
and it is nice to refer to things on a national level.
Kyle has his hand up.
Good morning, everybody. So this has been kind of a periodic issue on the disciplinary side. And so some of the suggestions that Dr. Yu's group is making with regard to adding citations to HIPAA are a little, in my estimation, a little problematic. Well, we have, by virtue of state law, the ability to cite to federal laws and statutes when we're doing disciplinary action. We don't, our ability to actually enforce those standards is quite limited. I mean, those are properly enforced by HHS, and there's another subgroup within HHS that actually handles most of these cases. And you know, while the HIPAA protections are largely parallel to the protections that are offered under RCW 7002, it's a little bit cleaner and it's a little bit more straightforward from a enforcement standard if we just stick to state law. I think reasonable minds can somewhat differ on this. So I know Mike has a fair amount of experience in this area as well, so I'd invite him to chime in. I know he's on. But again, it's my preference that we don't cite to federal laws because we don't really have enforcement ability beyond charging somebody with unprofessional conduct. I hope I'm making myself clear. But again, Mike, if you're able to and you want to chime in, I'd certainly welcome your thoughts.
Good morning, everybody. I don't have anything additional to what Kyle said, but that's the reason I left federal law out, because we have state law that adequately covers this. Although if you want to add the reference to HIPAA, it might have some educational purpose, but as Kyle said, it has no enforcement utility.
Could it be added in the introduction or something just to bring to, so that, you know, a provider who's reading it, they understand HIPAA, the state law. I mean, many of us have no idea what the state law is. So, I mean, so get it out of all there, but just say the state law is similar or goes along with the spirit of HIPAA. Yeah, whatever.
Yeah, in some ways, this is Pam. I feel like we could probably bridge that gap and explain that providers should follow HIPAA, you know, the CFR that's listed, which is true, and the state law. But when we actually address the discipline, that we just limit it to the state law, if I'm integrating what Kyle said. Because as a best practice, practitioners with their medical records do need to follow all laws, which include federal law. And so we're just recognizing that they should be aware of these. But as far as the disciplinary action, maybe just limit it, like Kyle said, to citing to the state law, which I could work on that draft language.
That's a really sound compromise from my perspective. Pam, I don't know how the rest of the committee members feel about it though. Dr. Curry, Dr. Domino?
I think it's a great idea.
Yeah.
Agreed. I do
Suggestion.
too. Yeah. I think they need to be aware. Any other comments on this document?
Can I ask one quick question?
Mhm.
Who sent this and why did they feel the need to add all this extra language that already is in our state law, actually?
So it's from the Washington Advocates for Patient Safety.
Is that
Dr.
Dr.
Curry.
Yu's group?
It is Dr.
It is.
Yu's group.
Yes.
Oh, Yan Ling's group. Oh, I didn't know that. Okay, got it. because all of the stuff about, patients have the right to ask for an amendment, the doctor has a right to a denial, but then has to provide it in writing and blah, blah, blah. All that stuff was, my understanding was in our law, like already, right? Okay, yeah.
Any other comments? Questions, concerns?
Can I ask one procedural question? So then if I work on that draft language, being new to this role, is it okay if I email it to all of the committee members, including anyone that might not be on the committee, but like Dr. Curry, who's here today, to see if that's the language that we want to move forward?
This is Heather. You can email it to the group. Yes, they just can't reply all and have a discussion via email. So, but they can give their comments directly to
me.
you as staff. Yes.
This is Micah, and I will beg and plead with everybody who wants to do this. Please just use the blind CC.
Excellent advice.
That will prevent anyone from having a conversation, and that's what I like from a risk management standpoint for the commission.
Many of us don't know what a blind CC is and how to do it.
So
we should have
basically,
instructions.
yeah. So Dr. Kohlmeyer will have access to the blind CC, which is the one right below the CC, which I guess that's pretty outdated for emails, is it? Because it says carbon copy, and we don't use those for like 20 years. And so that will mean that you won't see your name in the to or anything on the email list. So it doesn't allow you, even if you hit reply all, it'll just come back to Pam and whoever she puts in the CC column. And so generally the accepted practice is, if you're going to do that, just state in bold at the top of the email who it went to. That way we're clear on who we're talking to, but it prevents the OPMA violation that Heather's talking about, where you by virtue of reply all, you would have a conversation or a meeting of the commission, because you might have a conversation between 3 or more of you. And so that allows you to just reply directly back to the staffer, who can collate everything and then send you out what your comments were.
Okay, thanks, Micah. So then with this document, Pam, you will make some amendments, and then everyone will take a look at it. And when it's agreed upon, then we can take it to our meeting, correct? Okay.
Yes.
All right. And I have one other question for the team, for the group. When we pick this time, I know I deferred a little bit to Dr. Trescott because she felt that 10 a.m. was a great time for us to meet, but we don't have 3 of our folks here, and it might be because of their work schedules. Ed Lopez, I'm sure he's seeing patients. Scott Rogers is probably in his office. Dr. Trescott, I'm not sure if
I took a non-clinical day.
that works.
Okay, I
Yeah.
always work Thursdays.
Yeah, so I'm wondering, should we take a look at maybe polling again and see if another time would work, so that the 3 folks that aren't here, or at least Dr. Scott and Ed can make it? Just a thought.
So I will send an email out to all of the folks on the committee and get your feedback on when a good day and time. If you want me to change the day and time, I can
Okay.
do that as well.
I'm pretty sure Ed, well, I can't speak for him obviously, or anybody on there, but I'm just thinking that maybe if it were a time that were more acceptable, we could get those folks here. Thanks, Amelia, for doing that. Are there any other topics for discussion, or any other comments that people want to make before we adjourn? Well, thank you all. Happy New Year. And thank you, Pam, for taking over. So everybody knows, Pam is taking over for Mike Farrell. We could have said that in the beginning of this meeting as well. So appreciate working with you, Pam.
Great, Pam. Congratulations.
Thank you. Big shoes to fill. Mike's amazing, and he's been here forever. So There will be some bumps, but I'm really excited to work with Chris and with the whole committee. So thank you.
Me too.
Chris, thanks for getting in touch with me.
You're welcome. Thanks for
Hate to tell
joining.
everybody that I'm on the south coast of Spain right now.
Oh my goodness. Okay. Wow. Good for
I'm
you.
so sorry. But I'll see you guys at the January meeting.
Okay. Thanks all.
Bye. Bye.
We're adjourned. Bye. Have a good rest of your day and Happy New Year.